Good afternoon, and thanks for joining us for today's Healthline. I'm your host, Courtney Butts, and Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in the studio today. We'll be opening those phone lines soon, but as a reminder, make sure you're in a quiet room when you call with your TV turned all the way down. Otherwise, we may not be able to hear your question. That number to call is 318-219-4569. Today's Healthline 3 topic is weight loss, wellness, and a little bit of men's health. Joining me to talk about this is Irina Haskatis, co-owner and CEO of Shed It, and Catherine Rogers, a physician assistant with Shed It. Thanks for being here, ladies.
Thank you. Excited to be back.
Us.
Thank you.
Awesome. Yeah, so Shed It is in Bossier. Shed It on Shed Road is kind of your slogan. Love it. And how long have you guys been in the Bossier Shreveport area?
We just celebrated our second anniversary on June 1st.
Oh, awesome. Yeah. Well, congratulations.
Thank you. Thank you.
And you guys have helped so many people in the Arklatex to lose weight and maybe even maintain their weight loss.
That's the goal, at least, yes.
Awesome. So if you want to talk a little bit more about what you guys offer and what, Shed It helps, how you guys help people lose weight.
So we have actually a bigger range of services now. We offer weight loss injections, semaglutide and tirzepatide. We also have oral semaglutide now. We offer other oral medicine for weight loss. We do bioidentical hormone replacement therapy, and we offer the Gallery cancer screening test.
Awesome. So kind of the whole gamut. Yeah. So we talk about semaglutide. This is a really popular drug that's taken, across the United States. And so tell me a little bit about what you see before and after. I think you have some before and after pictures as well. So we can talk about those results.
Yeah. I think the main thing about the weight loss is the confidence that comes with it. Mm-hmm. So, the people are happy, of course, before too, but the confidence and the smiles that they have, unfortunately, the majority of the people is very self-aware and doesn't want to show their faces. So it doesn't really demonstrate the confidence that they show in the after pictures. But we see when they come to the clinic and tell us how this has been a life-changing experience and that they feel much happier, much healthier, that they added a lot of years to their life, that they finally can run around with their grandkids again, and that the mom that could not lose the baby weight feels confident enough again to wear dresses. And this, and I've been in this position myself, so I can relate, and it's exciting.
That's awesome. And so the weight loss is kind of that outward depiction of how they maybe feel on the inside, the confidence boost. Yeah.
And also the comorbidities that they may never have, possibly or hopefully, like diabetes and heart disease and a lot of other things. Catherine can probably explain more than me.
Yeah, that's awesome. So Catherine, can you tell me how these drugs work? We talked about it in our midday newscast, but I think that a lot of people may be on the fence with taking these injections or medications. So how do they actually work?
Yeah, so the semaglutide and the tirzepatide, they're the GLP class of medicine. They're actually working on receptors in your pancreas. They're helping to produce more insulin, better regulate your blood glucose. So after we eat a meal, your body turns that into just glucose. Some of that gets stored, that gets used for energy. Some of it just gets stored in, fat cells, liver cells, skeletal muscle. So these medications actually help to better regulate that, so your body can process that better. So we're not seeing the big spikes and things after meals. So you actually feel better, not the crash, at meals, things like that. But in turn, they're working in the GI tract, so actually slowing stomach motility. So you feel fuller sooner and longer. Your stomach's going to have that delayed emptying, so as you go to eat, you do feel fuller for sooner and longer. That comes with, obviously side effects, all being GI related. People who have some nausea, heartburn, constipation, kind of any sort of GI side effect. So really, really important to take the medication, but then also take precautions and be proactive on not having those side effects. So
gotcha. Yeah, and weight loss is a goal for many of these people, but what happens once they reach their weight loss goals? What then?
So we have a lot of people, once we get to our goal, we have what we call an exit strategy or a maintenance strategy. And so from there we see, you know, how we want to maintain. Some people want to get off the medication completely, and for some people that's possible. Some people who really struggle, they really do need to be on it long term. So from there we have just different maintenance strategies. We come up with an appropriate dose. Sometimes we stretch out that dose, so it's typically a once a week injection. Sometimes we have people stretch that out further, so their maintenance dosing may look more like every 10 days, even every 14 days, kind of according, you know, patient by patient. So we, like I said, figure out the appropriate dose and then the appropriate time frame on that. So
yeah, and it's very individualized, as you mentioned. It's one size doesn't always fit all, especially when you're dealing with weight loss and different metabolisms and different body sizes, and different goals too. So in some cases it can be long-term use, but in other cases you might taper off a little bit.
Yeah, we definitely have people that'll, you know, like I said, will stretch out that dose, decrease that dose, and then taper off to where we're off of it completely, and they continue to maintain. So much of that is the healthy habits that we've established too, while in the program, you know, things like good protein, movement, you know what I mean, lots of water, fiber, just kind of overall things that help us live a healthier and happier life.
Yeah, and so unfortunately, these services aren't covered by insurance, correct? But you guys do the compounding, which is a little bit more affordable in some cases.
Yes.
Yeah, if you want to talk a little bit more about that. You also do accept FSA or HSA?
Yes. Patients that have an HSA card or an FSA card, they can pay us. And we also had some patients that were successful submitting their invoices, like a super bill, to the insurance. So it's a long way, a hard way, but sometimes it works. So I would still encourage everybody of our patients to try and see if their insurance reimburses them. Right,
yeah, and you're not only paying for the injections and the pills, but you're also getting a support team too. So
correct. And we also have the Fit 3D scanner that is included in the monthly visit, which is great for tracking the progress, also especially to see how much fat you lost and how many muscles you built. You see the ratio. And we also have the monthly nutrition consult that comes with it too, which also helps with maintenance once you establish those healthy eating habits.
Right, and so this is kind of what makes you guys maybe different. There's always these pop-up places all over.
There's a lot of different places now, yes.
Yeah, but what, you know, this might be what makes you guys different, right? You have that support.
I think our comprehensive approach makes us different, and also that we have this individualized approach. It's really not one size fits all. We discuss the treatment plan for each patient. We can change the doses exactly how the patient needs it. So maybe the next dose is too much because they suffer side effects, so we can have a dose in between. There's a lot of places that would not be able to customize it to the patient's needs like this.
Right, that's a good point too. So, and you know, right now you said you offer the oral medication as well. This is kind of a newer offering.
Yes, it's oral semaglutide. It's a sublingual drop that you put under the tongue. And we don't have a lot of experience with it yet, but supposedly what you read about it, results are very similar. So this is specifically for people that don't like needles. However, it's a daily medicine. Like the injection is weekly, the sublingual drops is daily.
Gotcha. And so if you're wanting to move someone to maintenance on oral, what would that kind of look like if you're tapering them off? Or, you know, with the injections, you can just do 10 days or 14 days, as you mentioned, but what about with the medication? What is kind of your plan there?
So the oral semaglutide comes in 3 different doses. So we started a low dose. So really for maintenance on that one, that would look more like just doing that lower dose. And then sometimes we'll have people do it like every other day, but typically just getting back on that low dose, seeing how we maintain, and then maybe even stretching that out to take it every other day instead of daily.
Do you see a difference in the side effects from oral to injections?
No, the side effects are all going to be the same, just all kind of that GI profile of side effects.
Yeah, and it can vary from person to person. You know, you might have...
There's a lot of people that really have nothing, and then there's people that get diarrhea or constipation, and it really depends on every person. And also how diligent they are with drinking their water and taking their fiber supplements. And
Gotcha. It all kind of encompasses. So, okay. So transitioning just for a quick second, you recently opened Gladiator Men's Health, and you guys are a sponsor for our Men's Health Month. June is Men's Health Month, if you didn't know. And this is really important. You know, a lot of times maybe men don't think about, taking care of themselves. So what do you guys offer in Gladiator?
We are really the only clinic, at least in the proximity of like 50 to 100 miles, that offers a comprehensive approach like us. So we focus on the middle-aged men. We can help with weight loss, hair restoration, low testosterone treatment, erectile function. I want to call it function because it's not necessarily dysfunction. It can also be an enhancement. What else?
And then you also
and the gallery test.
Okay.
Yes, the cancer screening test. We also offer that at Gladiator.
Okay, and so the gallery test, it encompasses a lot of different types of cancers,
yes.
right?
I think 51, or was it 99?
I
different
think it's
cancers.
95 cancers.
95
total,
cancers.
yeah.
Nice. Okay, and that's just a blood test?
It's a blood test, yes.
Okay.
You can pick up the kit at the clinic, and then you go to a lab, and they submit it to the company, and then they send the results back to us.
Okay, and then the PSA, the prostate specific antigen, do you guys also offer that as well?
Yes, we offer that
to
as well, yes.
Gladiator.
Also
okay.
at a lab, yes.
Okay, yeah, gotcha. And, screening is so important. And you guys are kind of, with Shed It, you're in on this opposite spectrum of just, you're not like treating a disease necessarily, but you're helping prevent, or preventing
yes.
things like diabetes and heart disease and all these awesome things. And so how important, I guess, from your perspective, is it to screen and to, get ahead of things like cancer?
I really think it's the most important thing. I mean, it's really about life and death. Like just talking about the gallery test, I know it's expensive. It costs $900 or $849 that you pay to the company. However, if you have stage 1 cancer and they find it right on time, you still can live many, many years healthily. However, if you don't detect it, or it's stage 3 or 4,
Yeah.
Yeah, early detection is definitely key when it comes to cancer and things like that.
Yeah.
Mm-hmm. Yeah, and so do you guys also do like the weight loss injections with Gladiator men's?
Yes.
Like if they're wanting to, and they don't want to go into Shed It or
exactly.
something,
Yes.
they may not feel
yes.
as comfortable.
Yes. Gladiator is really geared towards men. It's a very manly environment. We only have male providers too, male providers, just so that men feel more comfortable. It's really their safe space to talk about topics that they would not bring up with their primary care doctor, that they would not feel comfortable discussing, or also where the primary care provider would not be the right person to ask.
Yeah.
So we want to fill this gap in our community.
Awesome. Yeah, I think that's great. And Gladiator's right next to Shed It, right?
Correct.
So
yes.
it's pretty easy.
It's in the same building. Shed It is Suite B and Gladiator is Suite A.
Even if like a husband and wife duo wanted to schedule their appointments at the same time,
carpool,
that's
carpool to the clinics. Yes.
Yeah, love that. Okay. So really reiterating how important health screenings are, not only just for men, but also women as well.
Yeah.
So we talked a lot about weight loss, we always do, but kind of going back to that maintenance aspect, what are some other services that maybe you guys offer in addition to the semaglutide? We did touch on, you guys have a nutritionist and you also have the consultations. So take me through that process. Maybe Catherine, you can speak to that. You have that consultation with them initially, and then how do you guide them through their goals and after that?
Yeah, so we have the initial consultation where we sit down and discuss medical history, come up with weight loss goals, and then a treatment plan. But then monthly we also sit down and have a consult. So seeing how we did, if we had side effects, what issues, what doses we want to do or change. We touch base on our nutrition, we touch base on our exercise. We have a list of exercise gyms and programs that we recommend and sort of partner with in town, as well as, like I said, just the protein handout. We partner with Glow Alchemy Kitchen, and they gave us a recipe book and grocery list, things like that, just to really be sure that we're doing good things for our overall health. We want to use the medicine as a tool to help us in that calorie deficit and achieve weight loss, but also with good protein, good nutrients, good just movement. Movement is so important for your body. So we do that monthly. So every month it's a visit, pretty in depth like that, to be sure that we're like she said earlier, drinking the water, doing the fiber supplement. Every few months we have everybody get on the 3D scanner just to really be able to see, you know, inches lost, progress gained there, besides just the number on a scale, because weight loss really is more than just the number on a scale. It's, you know, body composition, inches lost, fat loss, things like that too. So truly monthly it becomes a visit that's pretty in depth. So
yeah, that's awesome, and it reiterates that you guys are different because you're adding a lot of value to these clients. You know, you're not just giving them this injection and saying, all right,
out the door.
Right.
No.
Okay. Awesome.
We don't want to be like this.
Yeah. Well, if you're just joining us, we have Shed It Weight Loss on Shed Road in Bossier City, and we're talking all about injections. Maybe you have a question about it. Maybe you've been on the fence about doing these injections. Just give us a call at 318-219-4569. Maybe we can put you at ease. You know, because I think a lot of times people think about the side effects, or they don't want to use a needle, and so you have the oral options. That's awesome, and you're kind of meeting people where they're at.
Yes.
So tell me a little bit more about this Fit 3D body scanner. Anybody can use this, right? You don't have to have an injection or...
That is correct.
Yeah.
So it's free for our patients, but we also accept walk-ins. It's $40 for a month, but during this month they can come in 2 or 3 times if they want to.
Yeah.
I'm not sure if there would be results, but of course within this month it's free. And I think it's really interesting for everybody. Like the gym I go to, I offered it to several people, and the results are amazing, because when they finally know what their muscle percentage actually is, or their body composition, it motivates you, and it's very exciting.
Yeah, and so it's pretty accurate, you'd say?
Yeah,
too?
I think it's very accurate. And I always say numbers never lie, and the scale sometimes might show the same number, but if you build muscle, this number changes, or your body composition changes. And although you weigh the same weight, you still look fitter because you're slimmer or more toned. So I think it's amazing. I highly recommend it to everybody. So if you want to come in, Courtney, please take advantage of it.
Absolutely. And you can kind of project where you would be, right? It kind of can do that for you if you...
There is no projection, but there is a history.
Oh, a history.
Which of course is especially exciting for tracking progress during weight loss.
Yeah.
Or if somebody also works out or starts working out and does not necessarily want to lose weight but build muscle, you can track that as well, because you see all the numbers. You can like do an overlay of your silhouette. So I love it. It's exciting.
Yeah. And do you guys recommend like once a month is usually the best?
Correct.
Yeah, because slow weight loss is the best, or slow muscle gain, and you can't really expect a difference in a day.
Exactly. Yes, I think once monthly is a good basis. Yeah.
Okay. And what do you guys recommend as a healthy, sustainable rate of weight loss? Maybe they are going to try it on their own first before they, come to you guys. What do you recommend as a healthy, sustainable rate of weight loss?
I think 1 to 2 pounds per week of weight loss is going to be your most healthy and sustainable. Obviously, we have some months where we see more, some months we see less, just as your body adjusts to what your calorie deficit number looks like. But yeah, I think that 1 to 2 pounds per week is going to be your most sustainable.
Dang, not 5 to 10 a week,
Everyone wants it, but
right.
But I want to point out there is places that have a more aggressive approach. However, in my opinion, the more aggressive approach can give you more side effects, and also doesn't really help with maintenance, because you have to give your body time to adjust.
Right.
So faster is not always better.
And so can you give me a reason why, or explanation why faster is not always better? For your body, for your metabolism.
Right. Well, because you can reduce your calories to 800, 900, or whatever, but then over time your body adjusts to that, so then that becomes your new threshold for metabolism. So then once we're either weaning off, tapering off medication, or just start to adjust to that and become hungrier, once you start to eat over that 800 or 900, you gain weight, because your body's metabolism has just been set so low at that point. So it's really important to do a slow, steady, consistent calorie deficit, but not so drastic that we can't keep up or sustain that long term. So I tell everybody, obviously we want to be making good choices, good protein, complex carbs, healthy fats, but everything in moderation, because it's got to be how you're going to be able to eat forever. So, longevity, even things like keto, just good for a short term, but not good necessarily long term if you can't commit to eating like that forever.
Right, yeah. And a lot of times that extra weight that you're losing, it might actually be more weight fluctuation, or you're losing water weight.
Yeah.
You're not actually losing fat.
Yeah. Or if we begin to lose weight too quickly, even on the injections, we can see skeletal muscle, you know, the good, what we're wanting to keep, because that is where your metabolism lives. We can start to see muscle loss, and that's really, really not the goal.
Yeah, right. And you guys encourage strength training, or, you know, where you would lift weights or do body weight exercises so that you can gain that
we
muscle.
have several referral partners between Shreveport and Bossier, and there's really a place for everybody. There's these Pilates studios, and really like a gym, a CrossFit place, the YMCA. There's really something for everybody.
Yeah, and it kind of goes back to what works best for one client may not work best for the other, and so you really kind of discuss that in those consultations that, that you're doing.
Exactly.
Okay. Great. Okay, so so you know, kind of going back to, you're a professional, you know, you're a physician assistant and you're prescribing these drugs, right? And so why is it important for someone to go to a professional, you know, instead of someone that's just randomly popping up here in Bossier?
Yeah, so anytime I see people, we, like I said, establish your medical history, you know, allergies. There's a few contraindications to these medications. Medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2 are contraindications to this. We also try to get baseline labs on everybody because they can be, you know, used and abused. The other question is where's your medication coming from? Some of these places, you know, it's a compounding pharmacy, and so we don't have all the answers behind that. And so I just think it's important to go somewhere that you feel safe and that you trust, but also that there is a, you know, medical professional guiding the treatment, because, you know, we don't want you to have started with X on your lab and then, you know, had some issue or some trouble there and it just not be followed. So it's just important to be underneath the supervision of somebody that's, you know, carefully watching everything.
That's really important. And so we talked about a couple of people that may not be a good candidate for these drugs. So who is Shedit's typical ideal candidate?
It really can be for anybody. You know, sometimes it's
over 18.
Yeah,
not pregnant. Over 18, not pregnant. Yes.
Yeah, sometimes it's just people that have a few pounds to lose. Sometimes it's people that are diabetic. I have people that come in and just want to take pressure off of their knees and you know, joints and get around better with kids or grandkids. I have patients that come in and have, you know, been told they have high cholesterol for the first time, or people that, you know, just have a certain size in their closet that they want to get back to, and you know, they're doing everything right and just still struggling with it. There's women that are 40, there's women that are 60 going through menopause. We have men of all ages that come in. So really no right or wrong answer to it, but I would say, you know, like we always sit down, be sure there aren't any contraindications, and then like she said, have to be older than the age of 18 and then cannot be pregnant. Yeah,
and you kind of determine that pretty easy in that first consultation, and you can decide from there. And then so I just lost my question that I was going to follow up with.
But women with PCOS really benefit from these. People with hypertension, they just recently, I think we last time talked about or touched on that study about cardiovascular disease. These have been shown to, you know, the semaglutide has been shown to improve benefit, you know, morbidity and mortality, even with cardiovascular, from, you know, reducing the inflammation and things like that. So they're really used in a wide range of things, obviously helpful for obesity, but that in turn, you know, weight loss is not all about being aesthetically pleasing. It's also about reducing these other comorbidities that just become a problem, you know, later in life or down the road. And so trying to reverse that and then reduce your chance of those things down the road.
Yeah, and you mentioned it's not just obesity, but a lot of times with obesity, you might have metabolic syndrome, like insulin resistance, and all the things that you just mentioned, and the inflammation. So, yeah, that kind of was my question was, you know, we're talking about weight loss, and weight loss is important, and that's great, but what are some of the things that maybe you've seen in their lab values? Like, how have you seen people's lipid panels change, or their A1C, their hemoglobin A1C, or their their blood sugar change.
Yes, I've definitely seen people's cholesterol, I would say, is the number one thing that seems to improve. Now, I think part of that is also just lifestyle modifications. As we eat better and move more, cholesterol improves. But I have people that have been able to speak with their physician or their cardiologist and decrease their dose of their statin or even get off of their statin. Their A1C improves. I have people, blood pressure improves. I have people that came in on 2 or 3 blood pressure medications, and that was their whole reason in coming is, I need to see some weight loss because I don't want to be taking 3 blood pressure medications a day. And they're able to get off of those or at least get, decrease the dose. So I would say lab value wise, A1C and cholesterol are the 2 main ones that I see improve, but also just overall improvement in the quality of life. Blood pressure medications, just fewer medications that people can take after we're on these for a while.
Yeah, and that's life-changing,
right?
In some cases. So that's awesome. I love that. And so you also provide hormone replacement therapy for women as well. If you want to go into that.
Yeah, so that's we do this saliva testing. So basically, the first visit is we have a form that we have filled out, and that's a very in-depth history about. Age of, and it can be men and women, but a very in-depth history, especially questions about, history of cancer, things like that, age of menopause or age of first period, and then a big evaluation of symptoms for men and for women. Hormones are tied to so many things: our mood, our stamina, our sleep, our quality of life. Do we have
stress?
Stress, night sweats, hot flashes, just irritability, all kind of different things. So we have a long discussion about that, and then the kit, we discuss how we fill that out. They send the kit off. Like I said, that's through saliva. Send the kit off, and they come back and meet with me as well as the clinical pharmacist that we partner with, and then we come up with a treatment plan based off of number 1, their symptoms, number 2, their results, and then number 3, kind of how we think is going to best balance out those hormones and then not overshoot anything. So we do want to be conservative with hormone replacement. So but this is looking at estrogen, progesterone, testosterone, DHEA, and then cortisol at 4 different times of the day. So really trying to get all those little messengers, your hormones back in balance and in check to just live a better quality of life there too.
Yeah, and so they can do that while they're on the injections too. And a lot of times that can also be pretty life-changing too, because if you have lots of cortisol or high stress in your body, then that can also impact your weight loss journey too.
And help with maintenance.
Yeah,
because when the hormones are balanced again, you may not even gain weight as easily.
Yeah, and so that's a good point too. So it might be important to either, you don't have to be on the injections to come and see, right?
Oh yeah, absolutely.
Okay.
Patients can come in for the hormone consults by themselves.
And that might actually kind of kickstart their weight loss journey, because a lot of times if they're out of whack, then you might just be at a standstill. You're not able to lose weight like you would like to. Yeah. Okay. So we have just a couple minutes left, and if anybody's just now joining us, where can people find you?
Shedded Weight Loss and Wellness is located in Bossier City, 2211 Shed Road, Suite B. It's the purple door. You can call us at 318-746-3880, and you can also find us on social media, Shedded on Shed Road, on Facebook and Instagram.
Okay, and then just a plug for Gladiator Men's Health, that's right next to
It's right next door. That's 2211 Shed Road, Suite A in Bossier City. Our phone number is 318-754-6551. And we are on Facebook and Instagram as well as Gladiator Men's Health.
I'm very impressed with how you're able to spit out those numbers, And it's the gray door, right?
It's the gray door, yes.
Okay. And you guys have the injections and the oral pills, and this is something that is out-of-pocket pay.
Correct.
Yes.
Yes.
Okay.
Unfortunately, not covered by insurance.
Yeah, and you also have the cancer screenings, and you have all of these things to help people be proactive with their health.
Yes, live a happier and longer and healthier life. Yeah.
Awesome. Well, thank you, ladies, for joining us. and always a pleasure. Love talking about this. It's a great topic for the summer, and y'all will be back, I'm sure.
Yeah,
so.
oh yeah, it's not too late. Like, you can start the injection still and be ready for your next beach vacation.
Yeah. Well, and thank you for helping those in the Arklatex, and thanks for being here today. If you're just now joining us and you want to watch this episode or rewatch it, then all of this is on ktbs.com/Healthline3. Thanks for joining us.